Hello, so for my presentation I did Hypoplastic Left Heart Syndrome by Hlhs. Here we'll move on to the introduction. So it is a complicated and uncommon cardiac abnormality that manifests at birth. It's Hypoplastic Left Heart Syndrome. The left half of the heart is severely underdeveloped in the disease. The left side of your baby's heart is unable to efficiently pump blood to the body if they are born with hypoplastic left heart syndrome. Instead, blood must be pumped from the right side of the heart to the lungs and to the rest of the body. And here in this picture we can see the narrowing of the aorta, the pitching of the aorta, the aortic valve right here, closed mitral valve, and then we can see how underdeveloped the left ventricle looks right here. Then here we will move on to the clinical presentation, which is typically babies with hypoplastic left heart syndrome become extremely unwell within hours of birth. Among the warning signs and symptoms, it is grayish bluish skin tone, rapid challenge breathing, a weak pulse, cold hands and feet, and being unusually drowsy and inactive. And I got this from Mayo Clinic. And then babies usually get symptoms shortly after birth. Babies with hypoplastic left heart syndrome will not survive without surgery. So most babies will need a series of at least 3 surgeries during the first 2 to 3 years of life. And I also got this from Stanford Children's. So here we will move on to etiology. While the baby's heart is still developing during pregnancy, hypoplastic left heart syndrome can occur. It's also unclear what caused it. However, the likelihood of having another kid with the same issue increases if your family already has a child with hypoplastic left heart syndrome. Hypoplastic left heart syndrome is frequently without a known etiology. Genetics can be a factor in some cases. Babies that have mutation genes may be more susceptible to hypoplastic left heart syndrome, and also got this from the Cleveland Clinic. We will then move on to the prevalence. So approximately 1,025 newborns are estimated to be born in the United States each year with hypoplastic left heart syndrome, according to the Centers for Disease Control and Prevention. Accordingly, around 1 in 3,841 infants born in the United States each year have hypoplastic left heart syndrome. For the risk factors, you are more likely to become pregnant with another kid who has hypoplastic left heart syndrome or a disorder like it if you already have a child who has the illness. In addition to family history, there are no other obvious risk factors for hypoplastic left heart syndrome. So we then move on to prevention. So there is no way to stop hypoplastic left heart syndrome from happening. Before becoming pregnant, think about speaking with a genetic counselor and a cardiologist who specializes in genital heart abnormalities if you have a family history of heart problems, or if you already have a kid who has one. According to Sidini, Coomer, Chander, and Bohana, between 18 and 22 weeks of gestation, prenatal sonography can identify hypoplastic left heart syndrome using a 4-chamber image of the fetal heart, with the reported survival rate of 40% to 55% following prenatal diagnosis. So now we have the pathophysiology of hypoplastic left heart syndrome. So several completely developed structures on the left side of the heart are impacted by hypoplastic left heart syndrome, including the left ventricle is undersized and underdeveloped. Mitral valves are either absent or extremely tiny. There is no aortic valve or is very little. The ascending aorta is abnormally small or has an undeveloped ascending segment. In addition to having a hole between the left and right upper chambers of the heart, Newborns with hypoplastic left heart syndrome sometimes have an atrial septal. The left side of the baby's heart is unable to adequately pump oxygen-rich blood to the body in cases with hypoplastic left heart syndrome. And then the oxygen-rich blood bypasses the underdeveloped left side of the heart during the first few days of life for a baby with hypoplastic left heart syndrome. Due to patent ductus arteriosus, the patient's form of an opioid. However, in infants with hypoplastic left heart syndrome, it becomes challenging for oxygen-rich blood to reach the rest of the body with these holes closed. And here we move on to the diagnosis. So the hypoplastic left heart syndrome may be identified by a medical professional during pregnancy or soon after the baby is delivered. To assess the baby's heart while it is still inside the uterus, healthcare professionals throughout pregnancy employ prenatal screenings technologies including ultrasound and fetal echocardiography. Healthcare professionals identify the disease by watching symptoms and reviewing test findings after the baby is born. Babies may undergo examinations such as a chest x-ray, which will show the size and shape of the baby's heart and lungs, echocardiogram, ultrasound of the heart to evaluate internal heart structures. Then we have an electrocardiogram, which measures electrical changes during a heartbeat. And then we have a pulse oximetry screening, which measures how much oxygen is in the baby's bloodstream. So here we will move on to the treatment. So for the ductus arteriosus to remain open and working, prostaglandin is required in newborns with hypoplastic left heart syndrome for both the body and the lungs to receive the proper blood flow. Patients will require several procedures. First is the Norwood procedure. Babies need Norwood surgery within the first 2 weeks of life. During the procedure, it reconstructs the underdeveloped aorta to create a new aorta that will provide the body with blood flow. It establishes a shunt to redirect blood from the right ventricle or the aorta to the blood artery that supplies the lungs. It also connects the higher heart chambers to let the body to receive blood that is rich in oxygen from the lungs. At 4 to 6 months of age, babies need a second operation, which is a bidirectional Glenn shunt operation. It removes the old shunt, places a new shunt to attach the superior vena cava to the pulmonary arteries. By enabling blood to go straight to the lungs, this shunt can be used to lessen the burden on the right ventricle. Babies require a last operation between the ages of 18 months and 4 years. This last technique enables all blood leaving the body to return directly to the lungs rather than mingling with the heart. Surgeons will join the pulmonary arteries and inferior vena cava during a Fontan operation. The inferior vena cava is a sizable vein that connects the lower body's oxygen poor blood to the heart, just like the superior vena cava does. This is all the information from the Cleveland Clinic. And then from here, we will move on to the prognosis. So according to Seifel, Regan, Oster, and Correa, without surgical intervention, it is deadly and accounts for 25% to 40% of all newborn cardiac deaths. According to studies, the 1-year survival rate with hypoplastic left heart syndrome ranges from 20% to 60%. 3 to 9 with rather steady 5-year, 10-year, and 15-year survival rates of around 40%. Hypoplastic left heart syndrome is fatal without surgery, typically during the first few days or weeks of birth. Many infants survive with therapy, although the majority will experience difficulties later in life. Complications may include exhaustion quickly when engaging in sports or other exertions. So for complications, hypoplastic left heart syndrome is fatal without surgery, typically during the first few days or weeks of birth. Many infants survive with therapy, although the majority will experience difficulties later in life. One or more of the difficulties might be getting tired easily when participating in sports, heart rhythm problems, fluid buildup in the lungs, growth restriction, and formation of blood clots that may lead to a stroke, and developmental problems related to the brain/nervous system. And I got all this from the Mayo Clinic. And then just to conclude with all this, the disorder known as hypoplastic left heart syndrome is present from birth. Infants with hypoplastic left heart syndrome requires prompt medical attention. In the first few years of the baby's life, therapy often entails a series of 3 heart operations. Most kids need cardiac medication after these operations. Many kids also need to restrict vigorous exercise. With ongoing cardiology supervision, newborns with the syndrome can have normal lives. Then we have just any questions, anyone? No?